Hi, this is Jessica DeMassa, and I'm here with Unity Stoakes. He is the co-founder and president of StartUp Health. Welcome, Unity.
It's great to be here. How are you?
I'm doing great. How are you?
I'm great.
Good. So we're talking to you, and we want to hear a little bit more about the startup community in healthcare. And I want like macro trends. What's going on? You've been doing this for a long time. What's the pulse of the startup community in health today?
It is a magic moment in health today, and that is because the wave of innovation that's really happening all over the world. What I'm most excited about is these colliding conditions that are making it possible for really a reinvention of the whole health system. So you've got the changing business models, creating opportunities for new entrants all over the world. You have increased demand because of the aging population, chronic disease epidemics. So there's just this real need and thirst for new solutions. Right. You have the digital revolution coming in, not just things like genomics and data, but things like sensors, new platforms that are analyzing all this data. So there's new solutions finally. And then there's this wave of innovators and entrepreneurs all over the world. We're really seeing this on a global scale. Mm-hmm. It's no longer just in Silicon Valley or Boston or New York. It's happening all over the world. So when you mix this together, it's creating really an exciting moment to rethink the future of health.
Talk to me a little bit, too, about the investment community and how they've factored into all of this, because it seemed like with the Affordable Care Act, when that passed, it was like all of a sudden there was an explosion of just money to invest in startups and in like digital health and things like that and value-based care solutions and a lot of different things across the board. Are we seeing that pull back at all as a result of where we're at now, or are you still seeing that same kind of interest from these big investors, VC companies, angels?
There's really a flood of capital moving in to the market from all different sources, from venture capitalists to angel investors, but also the strategic money is flowing in, and there's also big sources of capital from like sovereign wealth funds now.
Okay.
So in 2017, there was $11.5 billion that came into the market for digital health solutions. You go flashback to 2010, there was just over $1 billion. So we're seeing a dramatic influx of capital. We do not see that slowing down. I know
it's not a bubble. I know we've heard like, oh, the digital health bubble's going to burst.
So let's put this into context. The healthcare market, it's a $3 trillion market in the US. It's a $10 trillion market globally. Mm-hmm. And we see this as an expanding market opportunity. So if you really look on it on that scale and how vast and big and how much need there is to transform the market, we see it's just getting started. I do think the last 5 or 6 years have been a moment of experimentation. A lot of the pipes are being laid, a lot of the testing, a lot of the networks. So the stage we're about to enter, I think there's going to be a lot more sophistication, a lot less feature-type companies, a lot more platforms, a lot more holistic solutions that are focused on outcomes, on really delivering value, and hopefully that will make a much bigger impact.
Just recently, we've seen, I think, a more assertive entrance into healthcare by companies like Google and Amazon, Berkshire Hathaway, JP Morgan, all of them kind of like stormed in now, and it's creating such a buzz. How do you think that's going to impact, I guess, the types of startups that we're going to see, kind of coming up and cropping along with them?
It really is an exciting time because you have all these new entrants, not just startups themselves, but as you mentioned, the technology companies, the world's largest consumer brands, companies like Apple, Google, Amazon, come into the market. But I think it's much bigger than that. Okay. I think what we're seeing is, in some way, every company is becoming a healthcare company. They're rethinking their business, whether it's a retail business like Walmart or Amazon, or a consumer company like Procter & Gamble, to the Cokes and Pepsis of the world. They're all trying to figure out the future of health and how it impacts their future as a business. And I think there's this shift in mindset from thinking of healthcare as a cost to trying to transform it into an investment and a future growth opportunity, a future market opportunity. So that's why you see, I think, CEOs like Tim Cook and Jeff Bezos really talk about their future as going big into the healthcare market. This is a great thing for entrepreneurs, startups, upstarts, because it's creating a new wave of customers, partners, investors, and really opportunity for them.
What are you seeing in the startup community? Like, what are some of like the trends? Like, are you seeing a lot? I mean, I know blockchain's really hot right now. Are you seeing a lot of blockchain startups? Are you seeing a lot of AI startups? What are you seeing? Are we moving away from those wearables or mobile app solutions? What are you seeing trend-wise?
So I think some of the most exciting developments are really not just around what I would call technology innovation, but around design innovation and business development, business model innovation.
Okay,
so
talk more
companies
about both.
so if you go to a country like India, they're probably 5 or 6 years ahead of the United States, as one example, around the business models of care, of going direct to consumer. So you have people paying out of their own pocket for MRIs, you have price transparency around different services. So you're seeing solutions there rethink their business model. What's exciting about that is you have companies now all over the world that are rethinking the traditional business models, because as we all know, who uses a health service versus who's actually paying for the solution are often different.
Right.
That's starting to change as more solutions are going direct to consumer. That's just one example.
Yeah.
When you start to get into other exciting trends, I think there's this really exciting convergence between technology solutions and what's going on in the real world. So
Okay.
we're starting to see health services around retail be considered again. We're seeing all sorts of stuff around transportation, just getting people to and from their doctor's appointments, as one example. All sorts of other examples around transportation in care, delivery of care. And when you start to extrapolate this globally, I think it gets very exciting because you're also starting to see regions like throughout Asia, India, China, 2 examples, where the adoption rate of these new solutions is rapidly emerging. It's just taking off.
Talk more about that, because I know, I mean, that's the thing here. It's like, truly I feel like health innovation is taken a step forward and become a real global thing, but there's not a lot of visibility on what's happening in other parts of the world. And so what are you seeing? Are there any hotbeds that you've got your eye on? And what kinds of things can we learn, being like US based or, in other countries even, what can we learn from some of these hot areas?
I think this is one of the biggest opportunities that really all CEOs, all health leaders should be paying attention to today, which is the global opportunity in health. And what we're seeing is that each region has its own assets. So the mobile health industry in Finland is extraordinary. I mentioned consumer health business models in India being very advanced. Med tech in Israel and different health tech being very, very strong, but in search of a market. All sorts of capital in Silicon Valley. When you start to leverage the key assets of different regions around the world and bring them together, learn from them, I think there's an opportunity to leapfrog. But what's happened for too many years is each region's been very siloed.
Yeah.
So now
Big surprise in healthcare.
Big surprise, but now what we're seeing is that's changing. So we have portfolio companies that are starting in Silicon Valley, but they're moving to India, they're moving to China. And vice versa. So there's this real cross-pollination going on, and I think that's going to speed up the cycles. But really, it's a global opportunity. There's innovation hubs. There's 40 or 50 significant innovation hubs around just digital health is one example, around the world. So that's a big change from even 3-4 years ago.
Hopefully we'll see a startup health paper on something like this in the future.
Well, you're going to see insight reports on this. You're going to see startup health hubs around the world. You're going to see all sorts of opportunity to really connect in with what we're doing, whether you're an entrepreneur, whether you're an innovator, whether you're a leader, or even involved in different governments or nonprofits. We're really trying to bring anyone who's interested in solving health moonshots together to achieve extraordinary things and hopefully impact the well-being of billions of people.
Last question for you.
Sure.
So we're asking everybody to tell us their WTF health moment, and we mean that in the kindest way, which is what's the future health? Things are obviously stuck in a lot of ways right now. So it's like, what's your WTF health moment? What's the future for startups? What's the future?
So this may be a dream, but we believe that instead of focusing on just a few 100 million people, really we'll be talking about improving the well-being of everyone in the world, billions of people. I think we'll start to very soon be thinking about the healthcare market across all 7 continents, across every human on Earth. And really, that's going to require some transformative shifts in terms of access and business model and bringing the cost close to zero. So our dream is really to make sure everybody in the world has access to quality care at hopefully close to free price.
All those moonshots, Unity, all those moonshots.
Yeah.
Thank you so much for joining us and
Thank
for
you.
sharing your insight with us. It's a pleasure to speak with you.
It's always good to see you.
Thanks so much. This is Jessica DeMassa and Unity Stoakes. Thanks so much.